Hello, welcome to this week's Lunch with the RDS. Today we're going to be talking about why equality, diversity and inclusion. Why is EDI so important and what benefits can it offer to your research? So first off, what do we mean by EDI, or equality, diversity and inclusion? Equality refers to breaking down structural barriers to make sure that everyone has access to the resources and opportunities that they need. Diversity refers to ensuring that there is representation from across the population. This involves making sure that there is a good mix of people from different backgrounds that are involved in a project or an organisation. And inclusion, finally, is the really key principle here. Inclusion is one of NIHR's 5 operating principles, and it refers to making sure that people feel respected, that they feel that they belong. Diversity without inclusion is tokenistic. Equity is also an important term that is increasingly being referred to. Equity is about fairness and justice. And this is really key because it's about recognising that everyone has different needs, rather than the idea of equality, which can sometimes be misunderstood as suggesting that we should just treat everyone the same. So exactly what's included when we think about EDI? Well, firstly, there are the protected characteristics from the Equality Act 2010. These include age, race, disability, religion and belief, gender reassignment, sex, marriage and civil partnership, sexual orientation, and finally, pregnancy and maternity. But in our work and in the NIHR more broadly, it's recognised that we shouldn't just limit our focus on EDI to these 9 protected characteristics. We also need to think about social class or socioeconomic status, whether someone's a carer, neurodiversity, literacy, the particular needs that certain underserved or seldom heard populations have, such as prisoners, homeless people, gypsy and traveller communities. Geography is also an important factor, and there are 2 aspects to this. Firstly, how research and research funding are distributed, making sure that we don't focus on those areas with high research activity, but low corresponding need. We need to make sure we're conducting research in the areas where the need for health and social care services and new treatments and addressing inequalities is greatest. Geography is also relevant in terms of making sure that research doesn't just focus on major urban sites, but that it's also relevant and accessible to rural and coastal and suburban areas. Career stage and sector is also important, providing opportunities for social care and public health researchers, for example. Now, there are 3 dimensions to the case for EDI that we're going to consider. The first is the moral case, and quite simply, that's that it's the right thing to do. The moral argument focuses on how the burden of health and care inequalities falls unequally on underserved communities. Research with homogeneous samples can cause harm because we don't necessarily recognise at the research stage how some treatments or devices might be ineffective or even maybe have adverse effects on those people who didn't get to take part in the research. Exploitative research practices are unethical and can damage relationships with communities. And a final aspect is that avoidable research waste through carrying out research that isn't representative or that can't be implemented is poor stewardship of public funds.
The second case for EDI is the business case for EDI. Now, should we even be talking about this? We've already made the moral argument for EDI, and it's the right thing to do. But it's worth considering the economic advantages of embedding EDI into your business or your research team. So benefits of diverse team include increased creativity and problem solving, and this is demonstrated through big businesses such as IBM having recruitment procedures that are really inclusive for neurodivergent people, and then having allowances in the workplace for neurodivergent people, such as working from home, social contracting, or wearing noise cancelling headphones. Valuing diversity also leads to better governance even, and leadership. And this leads to increased performance and resilience for employees, and employees have more trust and commitment to their employers. And this is demonstrated through a reduction in unplanned leave and also a reduction in turnover. So we're not losing anyone because we're valuing them. Also, by being inclusive and valuing equity in research, this leads to a reduction in health inequalities, where it can do. And these health inequalities cost, and we all bear the cost of that. So by reducing these health inequalities, we're actually saving money. The third case for EDI is the science case for EDI. And we can see that embedding EDI into science makes the science better. We ask more relevant research questions by using EDI. We can get more diverse and equitable public involvement. By using diverse recruitment strategies, we end up with a diverse sample. And by thinking of everyone, we find that data is collected respectfully. When it comes to disseminating our findings, we can do this in an accessible way. And when it comes to implementation, the intervention, if you like, is more likely to succeed because we've thought about everyone right at the beginning of the study. And people who have the worst outcomes before may have the biggest impact from our research.
So you might be thinking about how to put this into action in your own research. To help you to do this, we would recommend the RDS's Equality, Diversity and Inclusion Toolkit. You can access this online at the following link, and you'll see that there are 8 domains to help you work through the different phases of the research design journey. If you'd like to contact us, we can give you individual support with embedding equality, diversity and inclusion in your research project and with planning other aspects of your research project. We'd love to hear from you and work with you on your project. Thank you. Goodbye.